Hello, my name is Tanja Spanic, and first of all, I would like to thank for this great opportunity to present what I'm doing as a professional patient advocate in Europe. Please allow me now to share my screen. Today, I will tell you more about patient advocacy in Europe and what it is the impact on the policy and care. These are my disclosures, but none of them are relevant for this specific lecture. First, some words about Europa Donna, the European Breast Cancer Coalition, which is a big family of 47 member countries. And as you can see on this map, Europa Donna members goes beyond the European Union. We have members from WHO, geographical definition of Europe. So we go way beyond the Europe as the European Union. And why this is important, maybe you will see later through my talk. But all our members, all members of Europa Donna, the European Breast Cancer Coalitions, we are committed to the same goal, which is to ensure that all people in Europe have access to accurate information, quality screening, diagnosis, and treatment. I'm not just active within the European Coalition. I work also nationally. As CEO of Europa Donna in Slovenia, we work on a national level. Whatever we try to provide or to advocate for on a European level, we have to bring it to our national levels. Otherwise, those initiatives are not alive. And if I go just a few steps back and introduce Europa Donna in Slovenia, we started in 1997. The coalition started 3 years earlier in 1994. On the national level, we have physical members. We have members that are patients, people who really live the experience. We have caregivers, and we have healthcare professionals that are dedicated to our mission on the national level. And also we have a lot of followers on social media. I want to point out at this point that Slovenia is a very small country. Even within European Union, we are one of the smallest countries. We have only 2 million people, inhabitants, so that we have 16,000 and more than 16,000 followers on social media is a lot. On a national level, we cover also breast and gynecological cancers. And in this perspective, we offer a lot of psychosocial support to people with lived experience, survivors, caregivers, relatives. We do awareness, a lot of awareness campaigns about breast cancer and gynecological cancer, and we also do advocacy. We started as an advocacy organization, and we are trying to continue this. We are tightly collaborating with healthcare professionals, policymakers, and also patients, media, and all other stakeholders, academia, and we try to connect them. Very often, I'll talk about this a little bit in the end of my presentation, patient organization is the one who manages to connect all different stakeholders around the same table. And last but not least, on the national level, we started supporting local research only 5 years ago with a small funding that we provide for national research. And also we are included in several European projects, Horizon projects, EU-funded projects, and also clinical trials. But let's move back to the European level. And what are today's priorities of the European coalition, as I showed at the beginning, the big family of Europa Donna? Very important is that we are all promoting and advocating for Europe's Beating Cancer Plan, that all national countries adopt their national cancer plans. Also, ECIBC is European Commission initiative on breast cancer quality assurance scheme that gives the quality assurance for screenings, for breast units that we then advocate on our national levels. But on the European level, we try to educate and support patient advocates to better work on their national levels. And At this point, I feel it's really important that I show you all 4 pillars of Europa Donna as the European Breast Cancer Coalition, which are advocacy, information, education, and research. We try to connect those 4 pillars to empower, educate, and to impact our members, national representatives, and delegates to bring this knowledge on their national level and try to work in their national countries. Of course, we work also a lot on the European level, especially with advocating in European Parliament, like, for example, showing here a white paper about family cancer and family planning after the cancer diagnosis, advocating for fertility preservation from the very beginning. And the very, very last and so important topic is Breast Health Day. I will mention this also a little bit later, but Breast Health Day is something that we advocate on a European level to become a European-wide recognized day, 15th of October, as a Breast Health Day, as a prevention day that encourages women all around Europe and beyond to take care of their breast health with regular screening, with regular physical activity, healthy choices, self-breast examination monthly, and so on. How do we do this? How do we educate, inform our patient advocates, our community about all of this? We are co-organizer, one of the oldest European breast cancer conferences called EBCC that just recently in March happened in Europe. We are also organizing every 2 years our own pan-European conference where we bring representatives from our countries to share all these updates and new policy guidelines in a lay language that everybody can understand. We organize a lot of different roundtables throughout the year. And last year, Europa Donna, the European Breast Cancer Coalition, launched its own Empowered ED learning online platform. We have yearly trainings for new patient advocates from each country. 2 new delegates come to get the training. We organize every 2 years advocacy leaders, which is a little bit advanced training for patient advocates. And as I already mentioned, the educational platform. We are very tightly in Europe, at least involved in research, in many different European projects, and also our representatives are present in different clinical trials that are ongoing also globally, not just in Europe. At this point, maybe it is important that I show you these 2 initiatives that I'm showing here that we did in the past years, like writing the right white paper for cancer and family planning. We did this in collaboration with also other patient groups, and we showed a very important topic, how we have to work together. Cancer doesn't affect only the patient, it affects the whole family, the community, and fertility preservation is very important for younger women facing cancer. Another important topic is survivorship. More and more people survive, and we've been tightly involved in the adopting legislation for right to be forgotten, so that cancer diagnosis that once affects you as a young person does not follow you until the end of life. And of course, we also collaborate in scientific and policy reports, like Lancet Commission report on breast cancer. And the very important topic that is also very commonly left out is metastatic breast cancer. This is the cancer that affects and unfortunately takes a lot of women from us. That's why we started a campaign, the Cancer Currency campaign. Through the real imitation of the money, of the bill, of the paper money, we wanted to show the value of life. The value of life that cancer currency, that cancer affects. I already mentioned the right to be forgotten and to show you how this works on a national level from the European one. So there were different initiatives on the European level that unfortunately were not successful. But in 8 countries in Europe, we already achieved our national legislations. Here is just a timeline so you can see how this goes. It's not easy. We first started in 2016 in Slovenia, talking about the legislation right to be forgotten. And only in late 2024, the law was accepted. And in 2025, in June, it became enforced. So it's not some instant work that would happen quickly. We have to be there. We have to be present. We have to be, sometimes even, we have to make some steps back to achieve, to learn from one to another, and then to adopt this. I'm really proud that actually two patient organizations, Europa Donna in Slovenia and Lymphoma and Leukemia Association in Slovenia, we pushed this legislation. We even had an expert who wrote that legislation, that it was adopted. And another thing, how do we collaborate and get another very important seat around the tables, what we've been advocating actually globally, to get the patient voice, patient representatives on board from the very beginning of the trial designs. There will be no progress, no saving lives without better treatment. Of course, first we need screening. We need screening adopted in all countries, awareness of women why to go to the screening and how to care to themselves, but also how to treat patients better. So we've been advocating to take this from the very beginning as a part of the European projects, from the writing process to the contribution to review the actual work and the progress. And in the past few years, I can say 10 years, we see a lot of progress. Here are just 4 of the projects where we are involved, also as a small national organization, Europa Donna in Slovenia. 2 of these projects are actual clinical trials. One is combination of clinical trial and adoption of the new models of prevention of other chronic diseases after breast cancer diagnosis. And one project is strictly focused on quality of life for young people after the cancer diagnosis. Here, I would just like to show you our contacts where you can get in touch with us, and maybe give you some courage or some more power that you can start and work and improve whatever you want to achieve. There is a big value of lived experience in professional patient advocacy. And definitely there's also a very good advantage of connecting and working globally. But if we will not change something on our national levels, this will never affect the global level. Thank you again for your attention, and thank you again, organizers, for giving me this opportunity to take a place in such an important meeting. Thank you.